Obesity has been described as the most important risk factor for obstructive sleep apnea, and weight loss is recommended for most patients with obstructive sleep apnea and excess weight. A study in 690 adults found a 10% weight loss was predictive of a 26% reduction in the sleep apnea, whereas a 10% weight gain predicted a 32% increase. Weight loss intervention has also been shown to improve the measure of inflammation and insulin resistance in obstructive sleep apnea, an effect which was not observed with the CPAP. For some patients with severe obstructive sleep apnea and obesity who struggle with conventional weight loss strategies, bariatric surgery has been found to improve the apnea severity, but up to 20% of the patients may experience persistent moderate to severe obstructive sleep apnea after the surgery. A 6-month randomized study in 40 subjects with a BMI of greater than 30 kg per meter squared on a moderate to severe obstructive sleep apnea found a Mediterranean diet combined with increased physical activity was more effective for both weight loss and reduction in severity of sleep apnea than a prudent diet coupled with physical activity. Both the Mediterranean diet and prudent diet emphasize whole grains, legumes, fruits, vegetables, nuts, fish, and poultry, but the Mediterranean diet features more olive oil, suggesting an important role for heart-healthy fats in weight loss for sleep apnea management. Additionally, a low-sodium diet has been proposed to improve the symptoms of obstructive sleep apnea by reducing fluid retention, but it showed greater reductions in the patients than the diuretics, suggesting other potential benefits of a low-sodium diet for adults with severe obstructive sleep apnea. Exercise, even without weight loss, appears to reduce both the severity and the symptoms of obstructive sleep apnea. A meta-analysis of 80 randomized controlled trials found exercise training reduced the symptoms to a greater degree than the diet and was comparable to the CPAP for reducing daytime sleepiness. A study in 43 obese and overweight adults with obstructive sleep apnea found a supervised exercise program involving 150 minutes per week of moderate intensity aerobic exercise plus strength training led to reductions in sleep apnea severity, depressive symptoms and fatigue, and it also improved daytime functioning. In a randomized control trial, a 6-month graduated walking program, which increased in duration and intensity over the course of the program, improved not only obstructive sleep apnea severity and oxygen desaturation, but was associated with significant reductions in cholesterol levels. The well-established cardiovascular benefits of physical activity may thus have important implications for heart health in sleep apnea patients at risk of cardiovascular disease. Studies suggest alcohol use is associated with 25 to 33% increased risk for the obstructive sleep apnea. Alcohol is a central nervous system depressant, and this can contribute to the obstructive sleep apnea. Like other sedatives, it can decrease respiratory center activity and weaken the signals triggering the inhalation. It can also cause weakness in the muscular structure of the pharynx, increasing the tendency for the airway collapse, causing snoring and obstructive apnea. People with obstructive sleep apnea have also been found to be more susceptible to the effects of alcohol, and they may have a higher risk of alcohol-related automobile accidents compared to people without sleep apnea. For some people, sleep position has a marked impact on the severity of apneic and hypneic breathing during sleep. Lying on one's back is associated with the occurrence of obstructive sleep apnea as gravitational pull increases the risk for airway collapse. For some individuals with obstructive sleep apnea, changing the sleep position can improve the severity of disease. A study of 85 adults found that in patients with moderate obstructive sleep apnea, switching from sleeping on their back to on their side reduced the frequency of the airway collapse by nearly 50%. Simply turning the head so the body remains supine, but the head is rotated to a lateral position, also reduces the symptoms, although not as drastically as the full body side sleeping. Strategies for maintaining a non-supine position during sleep include using barriers such as firm pillows. Additionally, sleep position trainers in the form of a vibrational device or a smartphone app have been shown to effectively reduce the supine sleeping position, the symptoms and the daytime sleepiness in clinical trials, and they're associated with an over 75% adherence rate. Acupuncture has been explored as a treatment option for patients with obstructive sleep apnea with mixed results. Two small clinical trials found that acupuncture was associated with reduced symptoms and respiratory events using both manual acupuncture and electroacupuncture. However, a more recent randomized control trial found after 10 acupuncture sessions there was no significant change in the symptoms, blood pressure or the quality of life in hypertensive adults with obstructive sleep apnea. A meta-analysis of 9 clinical trials published in 2020 found that acupuncture significantly improved the symptoms, the daytime sleepiness and the oxygen saturation, particularly in the patients with moderate obstructive sleep apnea. Importantly, all of these trials have been small, and the quality of evidence supporting the acupuncture as a treatment for obstructive sleep apnea is low to very low, so larger, more rigorous control trials are needed. The effects of smoking on the risk and severity of obstructive sleep apnea remain controversial. However, the combined effect of smoking and sleep apnea has been linked to worse cognitive impairment and metabolic parameters. Although further clinical trials are needed to demonstrate the benefits of smoking cessation for obstructive sleep apnea severity, current evidence suggests it may improve important comorbidities related to sleep apnea. In addition to the interventions described, you can check out my videos on weight management, cardiovascular disease, chronic inflammation and diabetes, given the strong associations between sleep apnea and metabolic health. Oxidative stress is thought to cause many of the clinical signs and the symptoms of sleep apnea, including cardiovascular, neurological, and immune dysfunction. N-acetylcysteine is an antioxidant, and it reduces intermittent hypoxia resulting from the excitation of the sympathetic nervous system. In an animal model of sleep apnea, supplementation with N-acetylcysteine mitigated the oxidative stress and the inflammation that occurred as a result of the intermittent hypoxia. In rats, N-acetylcysteine in combination with an arginase inhibitor reduced systemic oxidative stress resulting from chronic intermittent hypoxia, including the normalization of the elevated blood pressure. In a randomized placebo-controlled trial in 20 adults with obstructive sleep apnea, 600 milligrams of N-acetylcysteine given 3 times a day for 30 days resulted in significant reductions in the symptoms, the apnea-related arousal, the oxygen desaturation, the daytime sleepiness, and the snoring. These effects were also associated with significant reductions in measures of oxidative stress, including decreased lipid peroxidation and increased total reduced glutathione levels. Although larger clinical trials are needed, these results suggest a promising role for N-acetylcysteine and antioxidants in the treatment of systemic symptoms associated with sleep apnea. Vitamin C and vitamin E are antioxidants, and they have potential roles in the treatment of sleep apnea. In an animal model of obstructive sleep apnea, treatment with vitamin C and vitamin E was associated with reduction in the marker of both oxidative and carbonyl stress, resulting from the intermittent hypoxia. In a preliminary study, 10 people with obstructive sleep apnea were found to have a dysfunction of the delicate lining of the blood vessels, the endothelium, compared to healthy controls, which improved to a level comparable with that of the controls after a single 500 mg dose of intravenous vitamin C. In another study, a combination of vitamin C 100 mg and vitamin E 400 international units taken by mouth twice a day for 45 days led to a reduction in the frequency of apneic episodes and daytime sleepiness, and improved sleep quality in men with obstructive sleep apnea being treated with a CPAP. Those who received the vitamin combination were also able to reduce the pressure setting on their CPAP machine. In a clinical trial involving 26 men, treatment with an antioxidant cocktail containing both vitamin C and vitamin E as well as coenzyme Q10, was associated with significant improvements in the measure of respiratory function in patients with obstructive sleep apnea. These results support the increased emphasis on the clinical trials examining the use of antioxidants in the treatment of sleep apnea. CoQ10 is involved in mitochondrial energy production and is best known for its beneficial effects for cardiovascular system and metabolism. As demonstrated in a study previously mentioned, CoQ10 in combination with other antioxidants improved respiratory function in men with obstructive sleep apnea. Although specific trials examining the use of CoQ10 in patients with sleep apnea are still needed, patients with sleep apnea are at an increased risk of cardiovascular disease, hypertension, and impaired glucose tolerance, and supplementation with CoQ10 may confer a benefit in all of these conditions. Selenium is a micronutrient and it's used in the regulation of many enzymes that are involved in the cellular response to oxidative stress and inflammation, including glutathione peroxidase. The role of selenium in obstructive sleep apnea remains unclear. In a 2013 study of the concentrations of trace minerals in 44 individuals who were newly diagnosed with mild to moderate obstructive sleep apnea, when they were compared with healthy controls, those with the sleep apnea had lower levels of red blood cell selenium and glutathione peroxidase than the people without the sleep apnea, and selenium was negatively associated with the symptoms. However, in a more recent study in 146 subjects, serum selenium levels were significantly elevated in individuals with obstructive sleep apnea compared with healthy controls, and selenium levels were positively correlated with the symptoms. The authors of the study postulated that elevated selenium may represent a defense mechanism in the patients with obstructive sleep apnea, and that antioxidant supplementation may improve the response. Although the exact role of selenium remains unclear, it's likely important for the progression of obstructive sleep apnea, and further investigation is warranted. Low vitamin D levels are associated with a wide variety of systemic effects, including the modulation of the immune system, myopathy, and inflammation. In recent years, there's been an increased appreciation for the role of vitamin D deficiency in the occurrence and the progression of sleep apnea. In a meta-analysis of 14 studies, including almost 5,000 subjects, serum vitamin D levels were lower among the patients with obstructive sleep apnea, which was incrementally exacerbated with increasing disease severity. Studies have also found that low vitamin D levels are associated with an increased risk for insulin resistance, diabetes, and metabolic syndrome in patients with obstructive sleep apnea. There's often an inverse relationship between the levels of vitamin D and the parathyroid hormone, and higher parathyroid levels have been found to be associated with an increased risk for hypertension in adults with obstructive sleep apnea. In a small randomized control trial in 19 white adults with obstructive sleep apnea, daily vitamin D supplementation, 4,000 international units per day, was associated with significant reductions in metabolic markers. However, neuropsychological and quality of life measures remained unchanged. Larger and importantly more diverse clinical trials are needed to examine the effect of vitamin D supplementation on obstructive sleep apnea and associated comorbidities. Mutations in the vitamin D receptor have been found to at least partially account for some of the variability in the vitamin D levels observed in patients with obstructive sleep apnea. Thus, genetically diverse populations should be included in the clinical trials. Sufficient levels of omega-3 fatty acids are associated with a host of cardiovascular and anti-inflammatory benefits, and this can have important implications for individuals with sleep apnea. A study that examined the red blood cell membrane fatty acid profiles of individuals with obstructive sleep apnea found that lower membrane levels of the omega-3 fatty acid DHA were associated with an increased likelihood of severe sleep apnea. Although there's been speculation that omega-3 fatty acids may represent a therapeutic option for the treatment of immune or metabolic comorbidities of sleep apnea, formal studies in humans are still needed. A number of studies have found people with obstructive sleep apnea, particularly those with severe disease, have higher levels of homocysteine, an amino acid that's linked to the increased risk of cardiovascular and neurodegenerative diseases. A 6-year analysis of 1,825 patients with obstructive sleep apnea found elevated homocysteine levels were associated with an 86% increased risk for developing the concurrent hypertension. The effects of CPAP therapy on homocysteine level is unclear, with some studies suggesting a modest improvement after 3 months of use, and others observing no effect after 6 months. A randomized control trial demonstrated a high-dose B complex vitamin reduced the measures of oxidative stress and inflammation, and studies have shown that B vitamin supplementation is associated with a reduced risk of a stroke. Although trials are needed which demonstrate a clinical benefit of the B vitamin supplementation in obstructive sleep apnea, evidence suggests that it represents a promising option for exploration. More information about the importance of keeping homocysteine levels low and strategies to do so are available in my MTHFR, methylation and homocysteine videos. Changes in the gut microbiome have been linked to a variety of systemic diseases. The prevailing theory is the gut dysbiosis causes damage to the intestinal wall, and this results in a leaky gut, which causes chronic low-grade inflammation. There's been increasing interest in the role of the microbiome and the gut dysbiosis on the development of the obstructive sleep apnea and associated comorbidities, but studies have so far been limited primarily to animal models. However, an analysis of fecal samples from 93 patients with obstructive sleep apnea reported varying degrees of microbial dysbiosis in patients who are dominated primarily by decreased levels of bacteria that produce short-chain fatty acids and increase the prevalence of disease-causing bacteria. Studies involving animal models of sleep apnea and intermittent hypoxia have found probiotics can improve some of the side effects of systemic inflammation in the heart and the brain, as well as hypertension. Studies in humans are needed to explore the effects of probiotics on obstructive sleep apnea occurrence severity. For more on herbs, supplements, and natural treatment plans, check out my website.